Okay, go ahead.
Okay, so I'm Lars Ensign, Dr. Ensign, and trying to do training this morning on the Porter Sentry Sedate nitrous oxide delivery system. And the unit here at Barton, it lives in this storage room. We're in room 8 with combination lock, and so the machine lives in there, and then also the delivery tubing and supplies that you need for the machine. But then you also, to turn the tanks on, you need a key, and this is in the Pyxis under Nitrous. My understanding is that they just have to override and get the key, so you can get inside the cabinet and turn on the tanks. So the unit, to set it up, the gas delivery monitor is electrical, so you plug it in, the electrical cord, you plug it into wall oxygen. It does have oxygen tanks in it, but the company rep said they don't really last very long, so recommended using wall oxygen. And then one of the keys, any spare parts to this that you need, I call this like the marsupial pouch, but in the supply pouch. And down here, there's a suction splitter, because most of the rooms only have one suction outlet, and you want to have the ability to have your suction canister for the procedure, but also the gas scavenger for this works on suction to prevent everybody in the room from getting exposed to the gas. So that plugs in to the wall, and then you would plug in your suction into one of these ports, and then you're going to plug in the gas scavenger to the other one. Okay, and so then an on switch on it, and here's one of the important things to understand about this gas scavenger is, I don't know if on the video you can hear this, but right now it's kind of making a suction sound, right? And that might kind of fool you into thinking that the gas scavenger and the suction is working, but it's got this little valve on it here, and this is critical to understand, because until you turn that valve on, the scavenger isn't actually working, and everybody in the room is going to get exposed to the gas. So you get all the things plugged in, and then you get your key, unlock the door, and then there's 2 nitrous tanks in here. We're going to try to have one of them marked with a tag that says it's the tank that's in use. For right now, what we're doing is the wrench to turn the tag on, or turn the tank on, is marking the tank that we're currently using. So, it's the standard righty-tighty, lefty-loosey valve with the wrench, and so you open that up. And then you can see on the front of here that you've got pressure. These dials tell you your oxygen supply pressure and your nitrous oxide supply pressure. So then you get your delivery tubing. This is the kind of tubing we're going to use for the majority of patients, and so it has a mask on it. These masks are just the standard mask that would go to like a bag valve mask, and you would fit them the same way for adult or pediatric patients. And I don't know if you can see on video, but the tubing it delivers nitrous and oxygen through the main port on here, but this extra circular level here, that's where the gas scavenger works. And so this thing plugs in down here. So this is the gas outlet for the nitrous oxide. And fortunately, the plugs are different sizes. So like the blue tubing fits here, and it's the only thing that fits here. And then the red tubing fits here. And then you can verify that it's like listening to a shell and hearing the ocean, but you can verify that you're getting suction and gas scavenger happening at the mask. So then, this is a continuous flow delivery device, and you got to set a flow rate. And so you start with oxygen, and there's a bag here. This bag is going to help you tell if you've got enough gas flow going to the patient. And so you hit this button and inflate that bag maybe 3/4 of the way or so, and you start some oxygen. And you'll see on the screen here, you get, like right now we're flowing 3 liters per minute. You need a minute ventilation that's comfortable for the patient, right? And if the patient is over breathing this, like if I'm breathing oxygen, you'll see the bag sucks down too much. If I'm over breathing that, so that somebody would need to have a higher flow rate and blow that bag back up. So kind of a good comfortable level in adults is usually like a flow rate somewhere around 6 or 7 kind of thing, and in peds like 4 liters per minute is kind of a good target. So we're gonna turn the oxygen flow up, and so I'm gonna go up to, we'll say 6.5, and you're having the patient breathe oxygen, checking your bag, kind of making sure it looks like they're comfortable. And then you're gonna turn your nitrous up to about 30%. Here's the thing though, is you notice like our flow went up to 10 liters per minute, right? And this, if I turn the nitrous up too much, this thing has a lockout. It won't go above certain flow rates, so then you can't deliver more nitrous oxide, right? So what you do is that as you're dialing your nitrous up, you would turn the oxygen down to get back around that 6 liters per minute flow rate, or whatever comfortable flow rate for the patient. And so then your patient, maybe they need more nitrous than 30%, so you can titrate this up. So as I'm titrating my nitrous up, we're up to 50% nitrous now. My flow, I'm going to titrate my oxygen back down. So, nursing staff may need to understand a little bit about turning these knobs up and down, because, for example, if you're doing abscess drainage and your gloves are contaminated, as the physician, you're probably not going to want to be touching the dials and getting everything gooped up. In any case, the highest the nitrous can go up to is 70%. Most adults are going to need, for good pain control, are going to need somewhere between 50 and 70%.
What will kids need?
Kids tend to be a little bit higher than adults in their requirement. So you have to just kind of play with these knobs and get flow rates. 70% is a little tricky because the flow rate's fairly high, like we're up to 15 here. There we go. So anyway, so you're having your patient is holding the mask on, but in pediatric patients, you may, for example, have to have the adults hold the mask on the patient. So then you do your procedure, and you're getting done with your procedure, and the patient needs to, basically their body is saturated with nitrous oxide gas at that point. And so if you just stop this machine and have them pull the mask off of them, basically as the gas is coming out of their body, the concentration of nitrous oxide in their lungs is really, really high, and they can transiently get hypoxic. I talked to anesthesia. They don't think that this is much of a problem, but it can happen. But also, every breath they exhale is going out into the room and potentially exposing other people. So you turn the nitrous off at the end of the procedure, but you have the patient leave the mask on and keep breathing oxygen. And you notice like our flow rate is down at 2.5. So as you turn the nitrous off, you probably have to dial the oxygen back up. And for another minute or two, you have them just breathing oxygen while they're off-gassing the nitrous that they're saturated with. And in any case, that's it. When you're all done with the procedure, you reverse the process of setting this thing up and put it away, and we're all set. Yes?
I have a question. Do we have a patient with a monitor?
The monitoring required is an oxygen saturation monitor. There doesn't have to be anything else. We don't have to monitor like end-tidal CO2. We don't have to have respiratory. We're okay to do this with a nurse in a physician kind of thing. But yeah, that's it. So it seems the tricky part, I think.